by Public Interest Law Centre, Section 27 is calling for the health sector to be included in South Africa's gender budget statement, warning that current budget decisions fail to capture the realities faced by women. The organization says that climate change, underfunded public health services, and unpaid care work are placing an increasing burden on women, yet these issues remain largely absent from the country's gender budgeting framework. To discuss the findings, we're joined now by budget analyst at Section 27, Matshidiso Lencoasa. A very good morning to you, and thank you so much for speaking to us.
Good morning, and thank you so much for the opportunity.
Matshidiso, perhaps let's just understand, the concept in terms of framing what is a gender budget. So what is characteristic of a budget that has a gender sensitive lens to it?
Yes, I think it's a really important question because often we do get wrapped up in the technicalities, especially economists and public finance economists. But basically, our assessment is that, or our understanding of the budget is that we're really calling for, when there are public finances that are allocated, they are allocated in a way that addresses or positions our state to be able to address the socioeconomic hardships that are facing our people. And the argument that we have made as civil society, as activists, is that because we live in a gendered, racial, class, a country racked by those norms, and not just a country, a continent at large. We live in a society where it means that when there's a child who's sick, or when there's a relative that needs to be looked after, taken to the hospital, it is often women who do that, especially in rural communities that we have done activism around and engaged with, particularly in Komani, but in the Eastern Cape, but really across the continent and in the world. And so we are just saying that if we are going to have a budget that really works, that serves the best interests of people in our country, and across in each country and in each context, to make sure that it also understands the ways that gender inequalities manifest, including, disproportionate care work, which I've mentioned as an example of looking after sick relatives or sick children, and that's not something that is paid for or accounted for in the GDP. So we have been calling for that. Unfortunately, our National Treasury has heeded that call after 30 years, and now we have a gender budget statement in the national budget. But we're really calling for it to take a step further and position the budget to genuinely understand that, for example, TB is disproportionately men who are afflicted by it because of the gender norms around in our country around accessing care, right? It's still seen as women's work, but at the same time, we also have interventions or looking after sick relatives, but also participating in paid care work, like being a nurse. The majority of nurses in our country, 89% of them at least, are women, and just recognizing that we are one country and we are one people, but how we experience our society differs. And if we have a budget that overlooks that, it entrenches the inequalities that we're trying to address.
And just staying with the care industry, particularly what should be state support structures, because some of it actually becomes very informal, and it still not only forms part of community work, but also does assist the state in its human rights obligations. So is there any acknowledgement of that in the 2026 agenda budget statement, just in terms of women's health, but the care industry as well?
Yes, and so our analysis is actually critiquing that if we're really going to make this gender budget statement go all the way, it actually needs to recognize that care work that we've been talking about, that you've brought up right now. One of the aspects is that in the first iteration of the gender budget statement, so last year, which was largely overshadowed by the budget that that government struggled to pass, but eventually did. The way that they had framed areas or projects around gender responsive budgeting, they were all economic empowerment. So sectors like the Department of Trade, Industry and Competition, which we welcome because, of course, women, we are fighting for equal economic opportunity, economic participation for women. But at the same time, we live in a society and we're operating in an economy that doesn't recognize that the only way to be, being a business owner or working a 9 to 5 is not the only way to be economically, to participate in the economy, and especially women at large are constantly participating in the economy, most prominently in the informal sector, but also in the care economies that both are not recognized adequately when we're calculating GDP, for example. I think about where I grew up in Emalahleni in Witbank. Yes, it's the coal it's a coal mining town and it's well known for that. But it's not the only, but in order for those coal mines to make the money and to reap the benefits that they do, and for us to get that windfall, it couldn't happen without being propped up by the informal sector, the women who are cooking for the mine workers, who are looking after the children, while the men risk their lives finding that. And so we are really calling for an all of society approach and a budget that reflects genuinely like how the different people in our country intersect and contribute towards an economy that works. And in its current state, unfortunately, it has overlooked that aspect.
And I want to use, because it often makes a lot more sense when people have this, visual uh, picture in their head of and transplanting it to their own community. So you speak about Emalahleni, where you grew up. So your report raises concerns about fiscal consolidation, debt service costs, and underspending. So, how do these budget decisions affect government's ability to provide essential services for women? So, if you could use Emalahleni, for instance, as an
Mm.
example, or any others that your report has zeroed in on.
Yes, I think it's such an important question because it is true that when we make budget decisions, ultimately it is the everyday citizen, the ordinary person who's affected by that. And so we have an economic framework currently, in a fiscal framework, so to speak, which is prioritizing. We spend more money servicing our debt than we do on any single line item at all, right? And more than we do on education, more than we do on health, social protection, or job creation. And unfortunately, in our country, we have very little to show in our communities for all this ballooning debt that we are taking out, because I think anyone, the listeners can chime in on this, that we are not seeing any new schools that are being built. There's no new school that's being built in Emalahleni by the state, or in any context. There's no new health facility that's being built, and so we're taking on this debt, but it's not reflecting as in advancing or realizing a better life for the masses of our people. And so we're really just saying that when government makes decisions like that, it's not a decisions that are victimless. So when we prioritize ballooning debt servicing costs with very little to show and to account for to the masses of our people, what we end up having is that we then have to spend more money on money that we could be spending on education, on healthcare services, etc. We're now spending it, giving it back to the borrowing class, so the elites who are borrowing money to the state. But as a people, we our constitutional rights to basic education, to quality services are not realized. And I think we're seeing that most pronounced in communities that don't quite have the same voice or the same prominence that places like, say, Johannesburg or Cape Town do. But the everyday person is shouldering those burdens, especially in a context where there's disaster, which is what our report speaks to around climate shocks. So when a clinic gets destroyed by a flood, or a road gets destroyed and there's no access to health facilities, it then is the ordinary person who then has to carry the cost of that, and find a way to maybe use the leftover, the little that they have from their 370 Rand a month grants, because our economy is not able to create a meaningful employment opportunity for that person, to take that 370 Rand less than that to be able to fight for their right to go and get care in a time of disaster. So it really is important for us when we're looking at the national budget to look at it more than just every year looking at is the price of cigarettes or alcohol going to go up, but really that every single decision that's made there, it is the everyday person who's affected by it. And as a person growing up in Witbank, I can tell you that we're not consulted enough when it comes to shaping these budget decisions.
Finally, what changes are you asking government to make in its next gender budget statement?
Sure. So I think the first one is quite clear in the report, which is that we do need to include and recognize care work, the care economy, and the health sector, and how women participate in the healthcare sector, but not just women, also, like I mentioned, men too, and how, the ways that men are deterred from accessing quality healthcare services, because that's also really important. That's one aspect of it. I think that another aspect or a really important intervention that government will need to do is to increase public participation when it comes to budget decisions, so that it can be a budget that's by the people, for the people. And then ultimately, I think it's really important for fiscal decisions to be underpinned by the constitutional rights. And the first question they should be asking is, how will this budget decision protect the rights of our people, and ensure or position our state to really do right by the people of our country. So those are some of the interventions and some of the thoughts that we have around, really just building a budget that is by the people, for the people, and works in the best interest of our people, so that we can really have a country, a nation that works for all.
Really appreciate your time and your insights. Matshidiso Lencoasa is a budget analyst at SECTION27, talking about government's gender budget statement, and just pointing out to us what some of the issues are and how they undermine, support services, not only in the health sector, but generally for women and girl children, but also it goes into vulnerable communities, and why government needs to be more intentional about it. And that brings the time to just about 8 o'clock.
A legacy isn't a statue.